welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host, always excited to be here. And today I want to offer you a little bit of motivation, encouragement, no matter where you are in your journey to becoming a future dental hygienist. Just remember, every decision you make is putting you on the path of becoming a dental hygienist, right? Every decision you make today is leading you on that path one step further, and you will get there in the end. You just have to keep going. And I'm really excited for today's topic because we're going to really get into what the top dental hygiene students do differently to truly succeed in dental hygiene school. There are different levels of what I view as successful in dental hygiene school. The lowest level I would say is passing your classes, graduating, becoming a registered dental hygienist. Okay, that is a huge accomplishment, right? That is a huge deal. And I don't want to discredit it. But there are some students who take their education to the next level and they maximize and get the most out of it that's possible. And what I see in those students is that they tend to go on and continue maximizing beyond just their dental hygiene years. And I think it's really because of the strong foundations that they build early on in dental hygiene school. And some of it may be the character, the type of people that they are. But I really think that it's not just dependent on that. And why is that? I really want to talk about, learning and education and expanding yourself and opportunity and how you put yourself out there and how you get to be a better person. And the only person who's judging you on if you're becoming a better person is yourself, or at least that's how it should be. Okay. And one thing that I really have always tried to do is compete with myself. How do I make myself better? What went right today? What went wrong today? How do I become a better person tomorrow and the next day? And I think because of that, I've seen some really incredible growth in my career and I've been able to do a lot of really unique and interesting things. And I just want the same thing for anybody listening. I want you to feel unstoppable. Despite the fact that maybe you aren't someone who has photographic memory or that you don't make all A's or that you struggled in clinic, I don't want you to ever hold yourself back because of your struggles. I want you to find ways to overcome and succeed those struggles so that you can better yourself every single day. And what I see top dental hygiene students do differently is they confront their struggles and they figure a way around them, right? Or over them or through them. They figure out how to really maximize themselves, their time, their learning, their education. And it doesn't take a rocket scientist to do that. And I think it's kind of funny. I actually know a rocket scientist. He is incredibly smart. So I think that that's a good analogy. But whenever I was, kind of growing up, when I was going through my bachelor's, I got my bachelor's in biology before I went to dental hygiene school. I would look around and think that I was just not very smart. I had to put in double the work that I felt like my classmates were putting in. My grades weren't reflecting the effort that I was putting in. Sometimes I just was like, is it even worth it to put in the effort? It's harder to do that than to go out and have fun on a Friday night, when I was in college. And I think I sold myself a little bit short. And the main reason was because I just didn't really understand how to truly work through my struggles, get the help that I need, and, overcome it, basically. I didn't really start learning that skill until I got into dental hygiene school. And when I did, it was like my whole world just opened up and expanded. And I started to see what was possible with this new way of thinking and being and behaving. And it wasn't like I changed who I was as a person. I just changed my strategy, essentially. And through all the years that I've been doing this podcast, it's been 3 years, probably almost to the day that I'm recording this, that I started this podcast. One thing that I noticed from the people that I have recorded with is that there is something that top dental hygiene students do differently. They go on to do life differently as well, and they end up doing these really cool things in their career. And with that, I want to kind of share some of those little things so that you can consider what is going to help me become the best hygienist that I can be and the best person that I can be as well. Because the learning doesn't stop once you graduate dental hygiene school. There's more to learn as a dental hygienist, but there's more to learn as a human. And that's just something I've been thinking a lot about lately. I've been going through this huge introspective journey, learning more about myself, really thinking about what do I want next, just not only in life and business and career, but really the whole thing coming together, right? What do I see for the big picture vision of my life? And sometimes the goals, the things that you want to do, they scare you. Right. And you may think you're not good enough or you're not smart enough to do those things. Like one thing, I think it'd be really cool if I have my PhD, but what are some thoughts that come in my head? The first is like, that's more money. Why do you need a PhD? What are you trying to prove? That's going to be really hard. It's going to take years, all those negative thoughts. Right. But do I think I could do it? Absolutely, I think I could. And why is that? It's because of this foundation of how I started to change my mindset, how I changed how I come across and manage really difficult things. And so, again, that's just what I want for you. So, let's really get into it. What do the top dental hygiene students do differently? First things first, they think about their schedule and their education differently. They go into it understanding that what they learn here is the foundation for their career, that they are going to use for the rest of their life. Now, that doesn't mean that they're going to be doing the same thing for the rest of their life, but they know that the skills and the knowledge that they earn here is just the foundation for taking them a step higher. Okay. And with that, you have to have a super strong foundation so that you can grow on it, right? You can't build a house on a sand foundation. So, first things first, think about how you're approaching your day to day life in dental hygiene school. I talk about this a lot, but are you taking care of yourself, right? Are you eating? Are you sleeping? Are you drinking water? Are you exercising? Are you seeing the sun? Those are important physiological baseline needs. But what I also see top dental hygiene students do differently is really how they approach getting ready and managing the material that is in front of them. So, first things first, before class, these top students are previewing the material. Now, it may not be that you get to do that every single day, every single time, right? Life is fluctuating. We have to roll with the times. You have to be flexible. You have to be adaptable. But more often than not, you should be preparing for the material before class, just doing at least a once over and getting an idea of where the class is going that day. Okay. Read the headings, read the objectives, anything in bold, look at diagrams, look at pictures, in the textbook. Just wrap your brain around what are we going to be talking about in class today. Then, if you can, if you have some time, just come prepared with some questions. Like as you're looking through the material, if you're like, that looks really confusing, or I don't really know if I understand that, just jot it down. Make sure you pay extra attention when your teacher's talking and then ask questions. Okay. So, this is the other thing. Top students, they do their best to pay attention in class and they ask questions, they get engaged. Now, I would say I was a top student, and it's not because I'm extremely smart. Honestly, I really don't know if I would have said I was a smart person until probably maybe last year. Okay. This is after years of education, years of teaching, right? And it's only because I've done it so many times now that I just know it, right? Because I've exposed myself and practiced and taught the material so much that now I just know the material. But that wasn't the case way back when, right? I was still growing and building, and there was so much that I was shaky on and didn't understand. Okay. So, what do you do with that shaky, not understanding information? You have to ask your teachers questions, right? And that was something that I definitely did when I was in dental hygiene school. I'm sure it annoyed the heck out of my classmates. I don't care. I was asking questions and I was engaging with them in class. One, because it helped me to stay engaged. I often got distracted, but I pulled it back together. And I was taking notes as I went along. Okay. Taking notes, try what works best for you. Maybe it's on paper, maybe it's on computer. I just interviewed a student who gave a great tip. She said, instead of taking notes, write questions, right? So that you can come back and answer those questions later. That will be in an episode coming out in September with Emma. Other things, this is your second exposure to the material. If you don't pay attention in class, you're going to have to teach it to yourself later. That is wasting time. Top students do not waste time in dental hygiene school. They maximize their time that they are given because they know that they don't have a lot of time, right? So pay attention in class and use that time to benefit you. Okay. Then after you're done with class, review the previous lecture. Take 10 to 15 minutes just rolling through that information. One thing I was thinking about, and I actually talked about this on the podcast with Emma as well, was basically when you first do your first review of it, maybe go through each slide and just be like, I'm going to pull something that I'm going to learn or write a question from each slide so that I'm going to review that today. And I'm going to have an idea of the answers to those questions today. Then I'm going to come back tomorrow and I'm going to look at those questions again so that it's sticking in my brain. And I may also write some new questions, right? I'm expanding on the information, but I'm not overwhelming myself. I'm just doing these quick reviews, right? Every time you review, it's an exposure, but we have to use active recall. Active recall is testing your brain. If you're not doing that, you're not a top student. Okay. Top students, they learn how to test their brain. Flashcards, creating quizzes, teaching it out loud. Those types of things are really going to help solidify it in your brain. Okay. The other thing that top students do a little bit differently is their study habits. They have a study schedule. They know what they're going to study and when. If you leave it if you're like, oh, here's my study block. Okay, that's great. Like, I think you should have a really well organized calendar that shows you when are you sleeping? When are you eating? Maybe that's a little bit too intense, but I want you to at least know your key blocks, right? When am I in class? When am I in clinic? When are my study hours? When are my sleeping hours? I think gym hours are good, right? Time to go work out or go for a walk or just something a little bit active. You need that blood flow pumping. It's good for your brain. Okay. But having all of those things kind of planned out, it lets you know what you're supposed to do and when, and that eliminates decision fatigue. If you don't know, like if you just put, oh, from 8 to 10, I'm supposed to study every night, but you don't know what you're going to study that night, you're going to end up getting distracted, scrolling through TikTok, or spending too much time on something and not enough time on another thing. So having a good plan in place is going to really, really help you stay on track. Okay. The other thing is top students, they study in small chunks. All right. So they may not be doing a full 8 hour long session. That's not to say they may not capitalize and spend a lot of time on the weekend studying, but they're going to do small daily chunks to loose, like kind of reduce that overwhelm to where they're not having to cram, right? Over like overnight. And then you get lack of sleep and that affects your performance as well. I'm not saying that top students never do these things. Okay. I just want to be clear. I'm not saying top students don't make any mistakes and they're not perfect. That's not true. They're learning, but these are just some commonly, I guess, common things that we see students who perform really well when I ask them. And again, I'm talking from my own experience, what I saw was successful in me, but also everyone that I've interviewed on the podcast. When I'm asking these questions, these are the things that they're saying. Okay. So study it in smaller chunks, which basically means like look at the information before the class, pay attention during class, look at the information again after class, and then start kind of spacing it out, studying in small chunks. Active recall, this comes up all the time, and the students who use it, they're performing better. Okay. Focus on understanding, not just memorization. But where a lot of people go wrong is they're like, how do I not just memorize, right? Like you do have to memorize. And I think that memorization gets a bad rap. But think about it. If I'm teaching you what happens with diabetes, okay, if I say patients with diabetes, if it's uncontrolled, they usually present with the three P's: polydipsia, polyuria, and polyphagia. You're like, okay, basic memorization. You're like, one, I need to know what diabetes is, right? It's high blood sugar. If you just memorize diabetes, three P's, okay, you only have one piece of the puzzle. You don't understand how they all work together to create those symptoms and what's the driver behind it. It's the high blood sugar. So when you get that first little chunk of information, build on it. Keep asking yourself why. Keep explaining it to yourself until you can explain it to someone else. Okay. So basically, you're just building a house, right? You're building a strong house of information. I also recommend, use multiple learning methods. We do very well listening, auditorily. So if you're out on a walk, listen to a lecture or listen to a video or a podcast or something like that. But also seeing things is really helpful and doing things is helpful as well. If you can combine multiple things together when you're studying, it's super helpful. Okay. The last thing I want to mention about studying that top students do is that they review the material before they forget it. Okay. So if you study something like you're like, oh, I'm going to read before class, and then you don't look at it again until a few days before the exam, of course, you're not going to remember it. You have to keep pulling those files out of the file cabinet, right? And looking at them over and over again so you know exactly where they are in your brain and your brain can pull them out at any time. So make sure that you are constantly reviewing material before you forget it. Okay. Once you start getting to a point where you're really memorizing it and you're like, oh, I know this, start spacing it out. Okay. If you look at it after 3 days and you're like, I still know this. Okay. Space it out. Look at it again in 5 days. Right. And then if it's like, ooh, 5 days, that was a little tricky. Okay. But I pulled it out of the file cabinet. Now stretch it again. Keep trying to stretch out those repeated exposures, and it makes your brain work a little bit harder to download it into your long-term memory. Okay, let's talk about clinical success now because top students do clinic differently. I will just say right now, clinic, oh my gosh, I was not the strongest in clinic, especially when I got started. I did not like I had a lot of doubts with my hand skills. I was like, am I doing this right? Really overthinking things. What really helped me was setting goals. What am I going to do for each appointment and what do I want to get done? I knew from this time to this time, this is what I was going to do. And I've had two students that have been on recently who said the exact same thing. When you're in clinic, plan beforehand. Get as much done before the appointment as you can, right? Can you go through and some schools may let you do this? Can you pre-type out your notes? Can you collect the medical history before the patient gets in the chair? Can you do this? Can you do that? What can you do to maximize what you can do outside of clinic so that you can maximize what you do in the clinic with your patient? Then when you go through and you create your goals, right? Try and get the goals a little bit faster each week. So if last week it took you an hour to do an FMX this week. Let's shoot for 55 minutes. Don't make them unrealistic. That's the same thing when you're teaching a patient a habit and you want to implement a new goal with your patient. Don't overshoot it, right? Just small incremental goals, right? You want these wins, okay? You can even keep a little timer in your op. That's fine, right? And then when you're done, go back and look at it again and see how much time did I actually spend? Where am I losing time? Where am I giving up time? This is where staying mentally organized is super important. If you know exactly what you're supposed to do and your next steps, then you will not flounder and you won't lose pointless time. I would just see that in students all the time. It's like they don't know what comes next. And so they end up just kind of walking around, talking, like just doing whatever and not actually making progress on their goals. Okay. So set a goal for every clinic session. What are you working towards? What do you hope to get achieved? What competencies need to get done? You have all of those things like scheduled out on track and you know what's coming down the pipe and you're going to maximize on those opportunities. Okay. The other thing is, top students, they welcome and encourage feedback no matter how hard it hurts. Okay. You may have some instructors that they can just lay the smack down when it comes to feedback and it hurts. It does not feel good. I've cried because of feedback that I've gotten, right? But at the end of the day, what did I do with that feedback? I turned around and I learned where did I go wrong and how do I not do that again, right? The thing is, you cannot learn unless you make mistakes. That's the truth of it. And when you do make a mistake, as hard as it hurts and it sucks and it feels bad and you feel like everyone's watching you and you're a failure, that is not the case because everyone else is failing and messing up something as well, right? Nobody comes through dental hygiene school unscathed, right? You are going to get feedback. If you're not getting enough feedback, ask for it. I had another student that I interviewed and they said, I asked for feedback. I asked for more. I wanted more and I got it, right? And you take that information and when you show a capacity to hold more feedback, you will get more feedback. And what happens? Your instructors will naturally teach you more. Okay. And like I said, the top students go into this program thinking, I want to learn as much as humanly possible. Now, we know that there's layers that have to build. There's a foundation that has to build, right? So you can't build the base of the foundation and then build the roof, right? So if you're in pre-clinic and you're asking, how do I do an extra oral fulcrum? Your professor's probably gonna be like, hey, that we're not there yet, right? And you have to trust your professors on that. But if you're trying to take it a step further and you're like, hey, how do I fulcrum a little better or pivot a little better or roll better? They're going to take that opportunity to show you and teach you, right? Because you show the initiative, you want to learn and you want to get better. It's just really hard for an instructor to deny that, at least from my personal opinion, that they want to help you, okay? And then just remember in clinic, every patient is a learning opportunity. Think about how can you connect what you learn in class in clinic? When you start seeing the direct relationship, why I'm learning this in class is why it's relevant in clinic, it starts to make you less annoyed with the material sometimes. Okay. I know so many people get annoyed with histology and embryology. I see this on social media all the time. They're like, it's been however many days since dental hygiene school, and I've never had to use one thing from histology and embryology. That is a direct lie. It's not true because what is histology? Histology is the study of cells, which is the study of tissues. Tissues make up organs, right? And we have to know the tissues in the mouth, right? You know that teeth are a hard tissue. The mucosa, the buccal, the labial, those are all soft tissues, right? Why do we see one in an x-ray and not in another? Because hard tissues are dense. They absorb radiation. They show up radiopaque on an x-ray. Whereas soft tissues, they're not as dense. The x-rays pass straight through them. They hit the film and they show up darker on an x-ray, right? You don't realize it, but you're using this information all day, every day. You've just categorized it in your mind to make sense for what you apply it to, right? So take that information and really think about how is it applying to my patient in the chair? It makes it so much more fun to learn that way. And I think a lot of people think learning's not fun or this is boring, but honestly, when you start coming at it from a different mindset that learning is fun, and when you start to see like, whoa, I don't know, I can't describe it, but it's like you start to see these connections and it just kind of makes your brain light up and get really excited. It's like that light bulb moment. Okay. So speaking of mindset, top students are not afraid to ask questions, especially in class, even if they're shy. Maybe you're shy, you don't want to say it in class. Go ask your professor after class. Go to office hours. Make connections with your professors. Make connections with your classmates. Ask them questions, right? Don't view needing help as a part of failure. You can't rely on others to get you through this program, but you can rely on each other, right? And you can ask your instructors, you can ask your classmates for help when you truly need it. And just, use those office hours. They're there, right? I would always go talk to my instructors. If I missed one question on a test, You better believe that I was in that office after the test. I said, explain it to me. What did I get wrong? I'm sure that my professors were like, Jesus, Dana's back again. She got a 98, but she's got to know where she lost those 2 points. That's how you grow. That's how you get better, is figuring out, what did I do wrong last time? Where did I mess up? What did I miss? From that, I learned test taking strategy. I learned, oh, I misread this question, or I misread what this was actually trying to ask me. That's why I got it wrong. Or I remember specifically in Perio, I got a question wrong about 1, 2, and 3 wall defects. I had totally misunderstood in class. I learned it the wrong way. I learned it backwards. I thought a 3 wall defect was worse, right? But technically, a 3 wall defect means you have 3 walls remaining of the bone. That's a better sign than a 1 wall defect, right? A 1 wall defect is like having 1 wall of your house up. A 3 wall defect is like having 3 walls still up, right? I'd rather have 3 walls than 1 wall. So I just totally misunderstood that concept, and I got the question wrong on the exam. I could have just brushed it off, but no, I had to know why, right? So ask for help, ask the questions. Don't be afraid to learn, right? That's what you're really here for. And the other thing is accepting those mistakes as a part of learning. It's really hard. We beat ourselves up. We think, I can't believe I did that. That was stupid. I made a mistake, or I should have known that and I didn't. We say all these things to ourselves, but the truth of the matter is we're all here to learn from our lessons, right? The brilliant Taylor Swift, she says, life is just a classroom, right? Maybe someone else said that before her, but I know it from that song. Welcome to New York. I think that's the one. So anyways, think about it that way. Life is just a classroom, right? Everything that you're learning is a moment, an opportunity for you to grow and continue on to be your best self. But it's all in how you look at it. It really is. Okay. This is where regular reflection comes in. I love journaling. I know I've talked about it before on the podcast, but if you're not journaling, I would really recommend it. Write about what went well, what went didn't, what's bothering me, what am I struggling with? Like, we need to be able to tune into ourselves more and figure out what is really bothering us. Sometimes you get really irked by something and like you're frustrated that you failed, but in reality, you're just tired. You're exhausted, right? You would have maybe accepted that failure better if you had gotten enough sleep, right? And then you start kind of working your way back and figuring out, I was really just tired. Like that was the problem. So I need to prioritize sleep. Or maybe failure like cuts you down and you think you're being rejected. You have a fear of rejection. I don't know where it's going to take you, right? But you want to take some time to reflect, really think about, when I get triggered by something, what is it saying? What is my body saying in response to that? Because that's a me thing, right? My instructors are here to give me feedback. So what can I learn from it? And think about that. Not only what can I learn in the moment, like literally to get better at being a dental hygienist, because that's what you're going to school for, but also how can I reflect on that as a human and grow and surpass that? I'll give you a little just a example of something like this. I had a situation that had come up and it really, really triggered me. It freaked me out. I thought my business was going to get shut down. It was like this whole thing. And, I took a moment to self-reflect and I was thinking about all the things that it was making me feel. It made me feel like I wanted to run away. I wanted to quit. I thought this is the end. Like, I don't want to deal with this is kind of what I thought. I don't want to have to deal with this. And took this moment. I said, okay, what is this triggering in me? Right. Obviously, it was a lot of fear. And then I asked myself, do I want to stop? Right. Am I doing what I feel like I'm supposed to be doing? Am I doing the right thing? Am I on the right track? Everything said yes. And so what I said to myself was, I am never going to let fear of doing what I know is right and what I'm doing is the right thing prevent me from doing that. And I'm not going to allow an opportunity to dictate how I feel about something like this again. Because in the past Dana would have probably been freaked out and would have walked away. Maybe, I don't know. But I told myself, I was like, this is too important to me. And I'm not letting that change like who I am and what I set out to do just because someone else thinks I shouldn't be doing it. Right. And you're going to come across that in your entire life. So reflecting on things and thinking through, how do I want to move through this situation? Right? What do I want to happen next? What do I want to learn from it? And I think that's the huge question. What do you want to learn when you go through dental hygiene school? Because I'll tell you the truth. I heard this phrase the other day. It's like, not what you have to do, but who do you have to become to get through dental hygiene school? The person you start out as is not going to be the same person that you finish at. You will be different in that you will realize you have so much grit and tenacity and that you are capable of doing really, really hard things. But it's like going up and down mountains the entire time. You're going to go up to the top of the mountain. You're going to be celebrating a win. And then you got to go back down the mountain and there's a valley, right? And then you got to climb back up the hill. There's another win and then there's another valley. that is not only dental hygiene school, that's life. Honestly, I think dental hygiene school might be a beautiful metaphor for life, really. It's just in like a 2-year span, you see all the crazy things that can happen and bring up all these emotions and feelings. But the top students, while they may have breakdowns, they may be crying, they may be struggling, they may be failing. Okay. So just because you think that they're performing well, you don't know. They could be failing, right? I failed things in dental hygiene school. I had a 4.0 when I graduated, and I failed things in dental hygiene school. Okay. It didn't stop me, right? I focused on that progress. I just decided to keep moving forward, right? One foot in front of the other and take ownership for it, right? You don't blame anybody else and you don't blame yourself. You just say, this is what I learned from this moment. I have to stay resilient and I have to move forward. This was a turning point for me becoming better. Okay. All right. The last thing I want to leave you guys with, the secrets that most students miss, the top students, they see it and they understand it. The thing is, they are not necessarily the smartest students. Okay. I felt this a lot when I was in dental hygiene school. I was like, I am not smart enough for this. This material is hard. It's taking everything I have to stay on top of it. I was studying all the time. And people would say to me, they're like, you just have it all together. Like you're doing great. You're getting all A's. I'm like, yeah, I'm freaking busting my ass for this. Right. I was studying all the time, but I was maximizing. How do I do it? Right. And I really was putting in the effort. And the other students I've talked to on my podcast, I've heard them say that same thing. They're like, I'm not crazy smart. I don't have a photographic memory. I don't read something one time and just know it. Are those people out there? Yes, good for them. That's great. But they're going to have their own difficulties in dental hygiene school. I don't want anyone to walk in and say, I'm not smart enough, because you can build smarts. I feel like I'm a testament to that. I finally feel at a moment in my life where I'm smart about a lot of things in dental hygiene, but I don't know everything. And there's still a whole world of things I don't know anything about. I don't know anything about rocket science, right? So being smart is relative, right? I think the smartest people in life and in dental hygiene school, they just keep pushing forward and they don't fall into the trap that they can't learn or do something, because you can. If it means something to you, you can do it. But if you don't ask for help, you don't put in the effort, if you are just trying to truck through it alone, or you're not taking care of yourself in the process, it's going to be that much harder. I know that you guys can do this. I know that you can put forth the effort. I know that you can become a future registered dental hygienist. So all of that to say, go forth and be an incredible dental hygiene student today. Take good care of yourself, put in the effort, study hard, and I can't wait to see you on the other side of this journey. All right, everybody, have an incredible day and best of luck on your journey. Future RDH.